Bismillahirrahmanirrahim. Today, a new rheumatology capsule regarding oligo-articular JIA, oligo-articular juvenile idiopathic arthritis or arthropathy. I started by this photo of this child, girl, kid of around 4 to 5 years. You should remember this photo of this little girl because this will remind you of all the criteria of oligo-articular GIA. Because oligo-articular GIA is actually more common among females, more common among young aged from 1 to 4 years, more common to affect only one joint. As in this, there is only one knee affected for this kid, and you should consist on the eyes because uveitis is very common here. So, oligo-articular GIA means arthritis in 1 to 4 joints during the first 6 months of the disease. It affects mainly girls from 1 to 4 years, although it may affect girls or boys of older ages up to near of 16. It is very rare to affect in the very old children around 16. And it may affect newborns or infant below 1 year age, but the commonest is girls from 1 to 4 years, usually affecting large joints, especially knees, ankles, and elbows, and it is most commonly to affect the knees, and in around 50% of cases it may affect only one joint, and it is usually the knee. So the commonest picture of oligo-articular GIA, especially the persistent subtype, not the extended, is to affect only one joint, and it is usually one of the knees, right or left knee. Here we should note that this girl is not complaining of severe pain, because pain is not so evident in these young children, so it may be only presented with painless swelling of joints rather than true pain, because the pain receptors and the pain pathway is not well developed in these children. Only the mother during, for example, bathing of or showering of her kid, she may notice that one of the joint is more swollen, or in this child she is already wearing a short exposing the knees, so it is evident that one knee is more swollen than the other. So the main complaint may be only painless swelling. The most important thing here is to exclude uveitis and make a frequent examination for the eye every 3 to 4 months, for example, because uveitis is very common, 15 to 20%, and it is usually insidious and subacute. The patient may not complain of uveitis until very late, which unfortunately may be irreversible. So you should remember this photo. The most common form of oligo-articular GIA is child, female from 1 to 4 years, only affecting one joint, and it is usually the knee, and you should exclude uveitis. Thank you for your attendance, and we will meet you in the near future with rheumatology capsules.